Let's go to another edition now of Hume and O'Neill. Federal MPs Jane Hume and Claire O'Neill going head-to-head. Both senior Victorian MPs, no doubt, fired up with the plight of their home city at the moment, halfway through, well, we hope, another lockdown. We've got special coverage of Melbourne's COVID crisis this week. We're going to begin by hearing from both Jane and Claire about their thoughts behind the latest lockdown. Let's start with the Shadow Aged Care Minister, Claire O'Neill. Claire, 4 cases recorded in Melbourne's aged care system this week. Labor concerned about the vaccination among staff, though.
Yeah, that's right, Tom. And can I just say that was pretty distressing news that we just got from the Victorian state government there. And I just want to say to all Victorians, we're here with you and we're standing with you. And this is obviously not where anyone wanted to be. One of the really terrible things that happened in the COVID outbreak most recently was to see that ultimately we saw COVID in aged care. You mentioned 2 staff members have been diagnosed now with COVID, 2 residents have been diagnosed with COVID, and we've had now, I think, 6 homes in Victoria that have had to go into shutdown. The thing that I know is so upsetting for people in aged care and their families in Victoria is that we did not have to be here in this incredibly stressful situation with regard to aged care. There's no question that this is the most vulnerable setting for COVID. We lost 655 Victorians in our last outbreak in aged care, and I never want to see that happen again in my home state. Now, we've also had Senate estimates this week, which has just shown a level of incompetence and negligence that I cannot believe I'm seeing around the vaccine rollout in aged care and with aged care staff. 57% of aged care residents have been vaccinated against COVID. And the government told us this week that they actually don't know how many staff have been vaccinated. Their best guess, which they generated through a survey of aged care homes, is that it's somewhere in the order of 8 to 9%. Now, I don't care what side of politics you line up on. This is unacceptable for us to have been a year into this, 110 days into a vaccination program, and the aged care minister cannot tell us how many staff have been vaccinated. So I just want to say we've got to get this sorted out. It's not just an issue for Victoria. This is a national problem. And when we have the next outbreak in whatever state it comes from, you're going to see the same thing. So what I want to see is clear targets from the government around aged care workers. It emerged this week that there's no plan. There's been no plan in place to vaccinate aged care workers, amazingly. We've got to see the minister step up and take proper responsibility for that, and I think that's the least that Victorians should expect from here.
We had the PM with a renewed push on that. We'll touch on in a moment. But let's go to Superannuation and Financial Services Minister Jane Hume. Jane, one positive from all of this, it does appear to have addressed vaccine hesitancy. Big queues all of a sudden forming and a lot of people getting vaccinated in Victoria in particular.
Well, you're absolutely right, Tom. In fact, we've seen a record-breaking week in vaccinations around Australia. Around 700,000 people have been vaccinated, and that makes a total of around 4.5 million doses that have already rolled out across Australia. We know that around 1 in 3 people over 50 have had at least their first dose. Around 1 in 2, or just over half, obviously, of people over 70 have had their first dose. So these statistics are really encouraging now, and we know that we even had a record day in Victoria. Over 23,000 people were vaccinated just a couple of days ago, and also a record number of vaccinations that have been administered by GPs and primary health networks. So there's some good news coming out of these vaccination stories. I myself have had my first dose of AstraZeneca just yesterday, and I'm paying the price a little bit for it today. But can I tell you what I fear the most? And that is speaking to those frontline health workers that were administering the vaccination yesterday. They were telling me how many cancellations they had or no-shows. So this was at Calvary Hospital in Canberra. Obviously, I couldn't get my vaccination in Melbourne. I'm a COVID nomad at the moment. Can't go home, otherwise I won't be able to get back into Canberra. But the hospital there were telling me that they'd had 30 people not show up, even though they had appointments booked just the day before. And even yesterday, when I was there about midday or so, that had 18 people already not show up. Now, it's great that Victorians are getting out there and getting vaccinated. That's really good news. Perhaps, if it's one good thing that can come out of this crisis, is that Victorians are now getting out there and getting vaccinated in droves. But we need the rest of the country to do exactly the same thing. So can I urge as many Australians as possible to get out there, get vaccinated for themselves, for their families and for their communities? It's the right thing to do.
frustrating for those of us that are not eligible yet that those appointments are going by the wayside.